Hello everyone, welcome to my YouTube channel. Today we are going to be discussing something I think will be very important. Hopefully that should be able to help and enhance your understanding, especially when you go for interview and you get a question such as maybe what is calibration. So we are going to dive into it in more detail. So today we are going to be looking at what calibration means. Okay, so before we continue, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So yeah, let's get into this. First of all, I want to give us a background because many of us have gone for an interview. They ask you a question, maybe things like how do you perform calibration? Sometimes they ask you what is calibration. Sometimes when you go for interview, they said if your quality control sample fell, what are you going to do? One of the things obviously that many of you guys have answered is you say you will do calibration. But sometimes when you say you do calibration, some of you guys, they ask you, so what then is calibration? And some people get stuck there. So I thought I'm going to explain some things, before I actually get into what this calibration is all about. Hopefully you will find it very interesting and important. Can I start off by saying that remember that in most cases, NHS hospitals are well computerized laboratory. So significantly, we use analyzer. So we make use of analyzer with limited amount of maybe level of manual testing. Okay, so most times we use analyzer to carry out any laboratory test. What that means is that when you talk about running a test, you run it through analyzer. Okay, what it means as well, if you want to run a test, you are using a patient sample. So that is when you are doing testing, when you are analyzing the patient sample. Okay, but there are also other situations whereby you want to do quality control. The same way you do the patient sample, you analyze the patient sample, is the same way you should be able to analyze the control sample. So it's still a control sample. And the same way you do that is also how you are going to do your calibration, because your calibration is going to use a calibration sample, like maybe calibration plasma or calibration serum or calibration blood, as the case may be. The only difference is this: when it comes to the analyzer, you've got to tell the analyzer what you are doing. Okay, so if it is control you are doing, you have to go to the control sign or icon and identify that for the analyzer to know this is what I'm doing right now. Okay, if it is calibration, you also need to let the analyzer know that you are doing calibration. Does that make sense? Now, in other some cases, what happens is that each of these samples can come with a barcode. For example, if the analyzer scan the barcode for quality control, the analyzer will know, okay, what I am doing now, once it scan the barcode, is going to know that this is for quality control, not for normal patient sample testing. In other words, sometimes when you scan the barcode, it can also know that, okay, this is for calibration plasma or for calibration sample. So what I'm doing right now is calibration. As the case may be, the same way you do your patient sample is the same way you do the control, is the same way you do the calibration. The only difference is letting the analyzer know what you are doing. So if you go for interview, they say, how do you do maintenance? Or how do you do calibration? Or how do you do quality control? You just need to know they all follow with the same principle. The only difference is you've got to let the analyzer know what you are doing, which I've already explained. So now let me give you that's why I give you the background about the quality control. So when you go for interview, they say if your QC fail, what are you going to do? You consider doing calibration as part of what you are going to do. Now, that means that calibration is a way of ensuring that quality control is maintained. Okay, therefore you can see calibration as a form of quality management system. Okay, and that is why, like I've said, we do calibration when quality control sample fail. That is, and let me also say this. Anyway, you are going to understand it as I progress. Even though we do calibration when quality control fail, it is not in all cases, which I'm going to explain. Okay, because when we say you will do calibration when QC fail, it doesn't happen all the time. So that is why they want to know, do you actually know what calibration means? Hopefully I'm going to help you to understand this as we progress. So again, you do maintenance, obviously. So you need to do maintenance, and before, where possible, you can do the calibration, as the case may be. Again, what is maintenance? Okay, because many of us will say this thing, we don't even know what exactly it means. maybe the best way I'm going to explain this is by telling you that each of these analyzers, they have what we call channels, okay? So have different channels. Remember, they aspirate reagent, they aspirate diluent, they aspirate maybe normal saline, they aspirate blood, maybe whole blood or plasma, as the case may be. So there is a lot of channels, a lot of things is going on, okay? So what maintenance does is to kind of do a background check. It will do some flushes of these very channels, okay? So it can wash off some, wash off the channel, flushes the channel to make sure there's any blockage, maybe like a clot or maybe cell growth or cell multiplication in a channel, or it could even be bacterial contamination in that channel. So it will flush it and then it will do the background check. Once it has flushes it and done the background check, if the background check and everything come out to be okay, then the maintenance has passed. But if it detects any problem, anything as the case may be during the process, the maintenance will fail. So again, the same way you manage your samples, the same way you manage the analyzer when you are running the patient sample, in the same way you also manage it when you do maintenance. All you need to do is to tell the analyzer, I want to do maintenance. And in most cases, it will tell you what to do step by step, okay? Now, in order to do calibration, the same way you have your patient sample or control sample, you now have what you call calibration sample, which is what you can say as a calibrator. So you have calibration plasma or calibration sample as the case may be, okay? So that is just to give you a background. I hope that makes sense. Now, let's get into this more proper. Now, what exactly is a calibration sample? So when you look at the calibration sample, you're looking at the serum, you're looking at the plasma or blood. It could be other substances like maybe tissue, DNA extract or RNA extract, cell line or microbial cultures as the case may be. Any sample that you are using to determine or to do your analyte, for example, in the case of full blood count, we use a whole blood. So your calibration sample is going to be blood, a whole blood, okay? Now, in the case of maybe coagulation or maybe in most of the biochemistry testing, we use maybe serum or plasma as the case may be. What it means that your calibration sample is going to be maybe something like serum or plasma as the case may be. So in microbiology, it's going to be microbial cultures and it goes on and on. So whatever thing that you use to analyze the patient sample is most likely what you are going to, the type of sample you are going to need for your calibration analysis, okay, or to calibrate your analyzer. I hope that makes sense. Now, let's start the explanation more in detail because we'll keep hearing the word calibration. What exactly is calibration? I'm going to start by trying to tell that calibration, what it means is a calibration curve. In fact, let me put it this way before I actually tell you the meaning. Calibration talks about a way or the targeted range, the target range in which the analyzer measures. So when you look at the range, the reference range, the target range, the limit range in which, or ranges in which analyzer measure, that is called calibration. For you to be able to understand this, we now need to talk about calibration curve. I purposely use these two graphs here, which are calibration curve, by the way, just to explain something to you, okay? Now, let's say, for example, if you look at this, because many of us who plotted graph, okay, maybe during our high school or as the case may be, or even, of course, during our university level, or maybe even when we do our lab testing, we plot graph. Now, if you look at this graph, this is y-axis, and this is x-axis, okay? This is talking about the absorbance, okay? What it means, what is absorbed, and this is the concentration in regard to the absorbance, okay? What it means that when you say 200 absorbance, okay? What it means that the concentration will be about 0.2 basically. So, and it goes on and on. So that's why you have this. It goes on and on, maybe something like this, and on it goes like that. Now, what does that really mean? You can see that obviously the concentration here didn't start from 0. It starts from 0.2. What it means that the lowest range here is 0.2. And the highest range you are getting here is about maybe 1.4. Does that make sense? Because if you look at this, it's 1.4. So this is a range in which it's going to measure. Okay? Now, if you are going to do a calibration, you must first of all generate a calibration curve. When you say calibration is a curve. Okay? It's a curve. And that curve will give the analyzer a targeted range or ranges in which it's going to measure whatever thing is going to measure. Now, stay with me here. What happens here is that if you run a sample, what it's trying to tell you here is that this analyzer, if you accept this, for example, it means that the analyzer that has this curve, okay, can only measure something between 0.2 to 1.4. That's what it's trying to tell you. It means that if anything is higher than 1.4, it cannot be able to measure it. If anything is less than 0.2, it cannot be able to measure it. Okay? Now, let's go to this other one. If you look at this one, you're going to see that the concentration here started with 0. Okay, you can see that there's a 0 here. Okay, so you also have different whatever, as the case may be, the y-axis and this is the x-axis. Okay, so you can see there's a 0. So what it means is that if this can be able to measure from 0 to what you get here, which is about maybe 10 point something, okay, or maybe let's just say 11, as the case may be. Okay, so that is what you are seeing here. Now, what that means is that if the analyzer is able to run anything between this 0, are you getting me, to maybe that's 11, as the case may be. So anything higher than 11, it cannot be able to measure it. Anything less than 0 or maybe like minus, it cannot be able to measure it, as the case may be. Now let us look at this as well here. So if you look at this print, you're going to see that in working this as well, in terms of this, you're going to see it doesn't get up to 0 again. So you now have maybe something like 0.2 as well. Then you have maybe up to maybe 0.7 as the case may be, or 0.6 something. So now what it means is that once it measures, if you accept this type of calibration curve, it means that anything, like you can see, this place is about 0.1, and this place is about maybe 0.6 something, as the case may be. What it means is that anything less than 0.1, it cannot measure it, and anything above 0.7 or 6 point something, it cannot be able to measure it. Now, what exactly am I trying to talk about here? I'm trying to say that when you say calibration, when you are performing a calibration, what you are trying to generate is a curve. And that curve you are generating is the target range in which the analyzer is going to measure. Anything outside that target range, the analyzer cannot be able to measure it. If you have experience working in pathology laboratory, in some cases you will see that maybe analyzer will try to run a sample, it will give you an error message. It's unable to determine that result. Now, it may not be, in some cases, it may not be because there is something wrong with the analyzer or there's something wrong with the reagent. It could be because that sample could be abnormally high or abnormally low, that is greater than what the analyzer can measure. Let me give you an example. If the analyzer can measure something like, let's say between 5 to 20, the calibration curve, what it generates is the abnormally low, normal, and abnormally high. But there is how far low it cannot go, and there is how far high it cannot go as well. So what it does is that, for example, from 5 to 20, what it means that if the result of that patient is very low, abnormally low, that it is less than 5, the analyzer cannot be able to measure it. Because of what? The calibration curve is generated between 5 to 20. Does that make sense? And again, if it is higher than 20, if the sample is abnormally higher than 20, let's say you get something like 20.5, or you get something like 21 or 22, because the curve is between 5 to 20, again, the analyzer cannot be able to measure it. And that, what it means that in such situation, then you then have to run that test manually. I hope that makes sense. I'm trying to explain that the calibration you are talking about is a curve. And that curve generates a targeted ranges in which the analyzer measures. Does that make sense? What it means that anything outside the ranges, the analyzer cannot be able to measure it. I hope I've been able to explain this. Now, let me now explain why sometimes we say, if my QC fell, I'm going to redo the calibration. It's not in all cases, but can I talk about what we call coefficient of determination? Coefficient of determination, which is this your R2. So this coefficient of determination, which is R2, talks about, it provides information about the goodness of a fit of a model. In other words, it shows you how good is the calibration curve. It shows you how good, how sensitive is that thing you want to determine. How very, good is it? So now what you want in this coefficient of determination is to be as close to 1 as possible. As close to 1 as possible. I think there's evidence to say that it can be accepted between 0.5 to maybe 0.9 as the case may be. But in the pathology laboratory, you want it to be as close to 1 as possible. Now, do you know why I said this? I want you to look at this very R2 here. and look at this ARU2 here. So I'm just trying to give an example. The ARU2 here is 0.9966 and this one is 0.997. Now, if you look at in terms of the accuracy, I know that they are not the same here. I'm trying to explain something to you. If you look at in terms of the accuracy, this should be more accurate than this one because it's very close to 1. So when you are determining your ARU2, you want it to be as close to 1 as possible. Now, let me not tell you why, if your QC fell, you can decide, okay, you know what, let me redo the calibration curve. There is a lot of, reason for it. But one of the reasons is that maybe if you check at the ARU2 and you find out that the person that accepted that ARU2, the person that did the calibration curve or that did the calibration accepted a range that maybe that could be modified, that could be better. For example, let's say this ARU2 is about 0.8 something. Or maybe it's about 0.91. You could decide to repeat it to get it up to 0.99, like you can see here. That is one of the reasons why we can do that. And obviously, this will now lead me to also say that each of the maybe control sample, okay, they can come with their own calibration plasma or calibration sample, as the case may be. So what it means is that one other reason why we repeat the calibration, if we find out that the lot number of the current control sample, are you getting me, is different from what is already inputted in the system, accepted in the system, what it means that you then need to redo another calibration which is consistent with the current control sample. I hope that makes sense. Let me repeat what I said. We repeat calibration when we say that your QC failed. One of the things you're going to do is to redo the calibration. I'm saying it's not in all cases. However, we repeat calibration, we redo calibration if we find out, number one, maybe the lot number of the calibration plasma or calibration sample already in the analyzer is different with the current lot. So what you then need to do is that in order to make sure that the current control sample is not running with the old calibration lot number, so you now redo it with the current lot number. Okay, now I'm also saying that even if it is the current one, if you notice that the person that performed the calibration did it in such a way that it does not, the ARU2 is a little bit far from 1, you can decide to repeat it to get it up to something very close to 1. I hope I'm able to make sense that calibration we talk about is a curve, and that curve it generates, it gives the ranges in which the analyzer measures. Anything outside that range, analyzer is unable to measure it. Okay, so and that is why the QC might fail if it's a different lot number, as the case may be. Therefore, calibration curve is a standard sample with known concentration of the analyte. So you know when you say calibration plasma, when you say calibration blood, as the case may be, so it's a known concentration, sample. So we know what is in it. So we can then use it because it's coming from the manufacturer. Okay, so we can then use it to calibrate our analyzer to give it the range of how sensitive it can be in determining abnormal low, normal, or abnormal high. So what it then means that this calibration curve can help to identify the concentration of an unknown sample. So when we've used known concentration like our calibration plasma, calibration sample, and do calibration. So once we've accepted that calibration, okay, curve, what it then means that with that curve, the analyzer then using that curve can be able to identify concentration of an unknown sample, which is the patient sample. I have spent time here to explain this because it is important we understand what calibration means. Okay? Now, what then is calibration? So calibration is a process of configuring instruments, okay, to provide results within acceptable range. So you can see the word has come again, acceptable range. So that acceptable range is a range generated by that calibration curve. So calibration is a process by which we configure, okay, we adjust the instrument to be able to provide a result that is within acceptable range. And like I said, that acceptable range is a range generated by the calibration curve. I hope that makes sense. Okay, now why do we do calibration? Remember, calibration is a form of quality management system. Obviously, from what I've explained to you, without effective calibration, without good calibration, you are likely not to get a reliable result. You are likely to get a wrong result. Therefore, calibration is a form of quality management system. We do calibration to maintain quality management system. We do calibration to ensure accuracy, reliability, or reliable precision. We do calibration to ensure that the compliance, to make sure that the laboratory is within conformance, okay, that the standard is maintained. So we do calibration, you know, as a form of instrument maintenance, to make sure that the instrument is functioning the way it's supposed to do, to be able to be give us a reliable result. We also do calibration to make sure that, you know, any form of a deviation or any error will be corrected. Therefore, calibration helps to correct any deviations or errors. And again, we do calibration to maintain quality. I hope that makes sense. That is what I've got for you. So I have spent my time during that very, you know, when I was on the graph, to really explain to you what calibration means. Hopefully by now you now understand the meaning of calibration. So when you go for interview, they say, what is calibration? You need to know what you are talking about. Calibration is a curve. Anyway, thank you very much for listening. And if you do have any question, please can you just put your question on the comment section and let me know what you think about the the video. And please, can I ask you to subscribe, share, like? Thank you very much, and I wish you all the best till I come back your way again. Bye bye.